part 2 in our anatomy class, where we are continuing to talk about epithelium. Please check out part 1 for the introduction of epithelium so that it can be easier for you to understand what we're going to discuss in this lecture. So, as said previously, these are the functions of the epithelium: protection, secretion, absorption, filtration, excretion, and secretion. So, these functions of the epithelium, as you can see, there are quite a lot. So it depends on the structure of the epithelium and where this epithelium is located. And another important thing to know about epithelium is the naming. The name of the epithelium tells you a lot of information. So each epithelium actually has got 2 names. And the first word has got a meaning, and the second name also has got a meaning. So the first name. It tells you about number of layers, and then the second name tells you about the shape of the epithelium. So with the epithelium, there could be 1 layer or more than 1 layer. If it's 1 layer, it's called simple. More than 1 layer, 2 layers going up, it's now called stratified. So these are the prefixes that you will see in naming most of the epithelium. Now, what does the second name tell us? The shape. So there's 3 shapes. There is squamous, the shape of the squamous is something like this. And then we have cuboidal, which is sort of cubes, like squares, equal sides. And then we have columnar, which looks like columns. So if the name says simple squamous, so this is the second name and the first name. So if the name says simple squamous, it means there is just 1 layer of this. If the name says stratified squamous, it means there is more layers of squamous. So there is more layers of squamous, more layers of squamous, more than 1 stratified. So, if the name is simple cuboidal, it's just this 1 layer. If the name is stratified cuboidal, it's more than 1 layer of the cubes, of the squares. If the name says simple columnar, it's just this. If it says stratified columnar, it means it's more than 1 one layer of columns like this. Hence, by just seeing the name of the epithelium, you are able to have an idea of the structure of the epithelium. So, let's go back to our functions. We said the epithelium helps with protection. What kind of a layer do you think will be good, especially between the simple and the stratified? Which one would be good for protection? Because we said it depends on the form, how the structure of the epithelium. That structure will determine the function of that epithelium. So, if that structure is stratified, that means it's got more layers. It's got more layers. It's got more layers. If it's stratified, then that is the epithelium that is good for protection. It's actually, its function is for protection. Do you think a simple layer can be good for protection? I don't think so. It's just one layer. So it can't be good for protection. Now, that means simple layer of any form is not good for protection. Now, secretion, absorption, and filtration. These three, we require secretion, absorption, and filtration. We require a simple layer because for movement of substances in your stomach, for substances to be absorbed, you want the layer just to be one, so that it shouldn't be difficult for exchange of the nutrients. In the gaseous exchange, for oxygen to be exchanged with the carbon dioxide, you just want one layer. You don't want to make it difficult by having multiple layers. So for digestive system and the respiratory system, particularly in the alveolar where the exchange takes place, we need the simple. You will see when we go in depth in another video whereby the epithelium in the respiratory system can also change depending on which part of the respiratory part we are focusing on. But as for where the gaseous exchange takes place, we want it to be as simple as possible. Hence, we want a simple epithelium. And the filtration in the kidney, at the glomerulus, where the filtration takes place, just simple epithelium will do. In the next video, we will go in depth about special epithelium that assist in excretion and the sensory part. Hope you understand. Remember to go to the first video. It's is the start of the series of the epithelium lectures. So this is part 2. Let's move on now to part 3. Thank you.